So Michal asked us to talk, and one of the things she sort of started with asking us was to talk about the difference between a midwife and an obstetrician. And I actually thought I would read on one of our websites that represents midwifery. What is a midwife? Midwives are independent practitioners that provide health care. So we do maternity, gynecologic, reproductive, contraception, and primary health care. So from adolescence to postmenopause, and also for newborns in the first 28 days of life. So we're licensed independent providers, which means we're our own profession and can provide healthcare. And that, and thinking about that and the difference with an obstetrician has a lot to do with philosophy, and because obstetricians also are licensed providers of healthcare, but they have a different philosophy and a different focus on.
Yeah, and one of the things that can be confusing where MDs are regulated by basically the United States of America, midwives are regulated differently in each state. And so there's several different licensing procedures, and you've probably heard of a certified nurse midwife, but there's also a certified midwife in New York. And then there's certified professional midwife, and there's not a licensing procedure for them here. So even for those of us in the profession, it can be a little confusing as to what a midwife does. We both took the nursing route, basically so that we could get a license. I mean, I went to school in California, and I went through the nursing route because that was the only way to become a legal midwife. And so, so different states allow us to do different things, but in New York and California, where I trained, we have a very large, what we call scope of practice. So my youngest patient was 13 years old, and my oldest patient that I've cared for is 96. And so that really gives you some idea that midwives can care for women for a lifetime. And in some states, women midwives become add sonography. They can do vacuum deliveries. And I was also trained as a first assist. So I would go in with somebody who did the C-section, and I would be the second person. The OB would be number one, and I would be number two, supporting them. Here, like at Maimonides, that's done by residents, medical students. But at Woodhull, the midwives can go in and assist with a C-section. And people usually don't know that midwives have such a large scope of practice. These are all the people that didn't want to do the jewelry, right?
Come sit, yeah, everyone sit, yeah.
So the difference between a midwife and an obstetrician is that an obstetrician there's several levels of obstetrician also. So you become a medical student, and then you graduate and you become a resident to become an obstetrician. You can graduate as a OBGYN, and then you can do another 3 years of study and become a maternal fetal medicine doctor that takes care of very high-risk pregnancies. If you've gone and gotten a sonogram at an independent facility, there's usually a maternal fetal medicine doctor that looks that up. So even amongst the OBs, there's some different levels of care. But for tonight's talk, we're kind of talking about midwives who attend women in their reproductive age, and obstetricians who deliver babies or do C-sections in the hospital. The difference is the difference between a midwife and a doctor. I like to joke, and Mahal appreciated this, that in order to keep a midwife's attention, you have to stay well. And in order to have time and attention from a doctor, you have to stay sick. Because doctors like to treat illness, and midwives like to be with you when you're well. So that's one definition of it. And how things have gotten a little hectic is a lot of normal women in America go to see obstetricians when they're well. And sometimes there's a conflict around that. I don't know what else to say about that. I mean, I could go on and on about why the differences that people see, but maybe you could tell us what you want to hear about tonight.
Yeah. Yeah.
Did you ever go to, like, do you work in a center? Do you attend home births? Do you work in hospitals? Like, what do you?
Yeah, so I have a very long history, and I actually, after I had my third baby at home, I apprenticed for 5 years in a home birth practice, and then I went to school, and I got a bachelor's in nursing because was the legal route, and then I got a master's in midwifery, and then I worked in hospitals. And then I worked globally, and then I worked in hospitals again. And 9 years ago, I came back to home birth. So midwives can work in a variety of different settings, home and hospital, and they can just do GYN care in a clinic, or they can do home GYN care. So.
And I trained in New York State, and I have a bachelor's in nursing and a master's in midwifery. In New York State, all midwives are currently, there are some older midwives who may be grandfathered in, but all new midwives are masters prepared in midwifery. And some of the newer programs, they're moving towards doctorate in some programs. So, but yeah.
Do you guys work together, or?
We do. So we and I also worked in a birth center, worked in hospitals, and I have had a home birth practice for 13 years. Barry and I have been together in a home birth practice for 4.5 years.
But we met working at Bellevue together almost 18 years ago.
As midwives in the hospital.
Yeah.
So, yeah.
Can you just repeat the question? So
Absolutely. Yes.
Okay.
Next time.
Not that question.
Yeah. Next time. Sure. So yeah, questions are going to be the easiest for us to, yeah. We don't really have a prepared.
In, like, one hospital, or you guys can go to any hospital that the person wants? Or?
So the question is, can you work in one hospital, any hospital where a person wants? So when you, when we worked in the hospital, where we met, we both worked at Bellevue. We were employees of Bellevue Hospital. That's the only place we could deliver. That was who paid us. That was where we worked. If you are a private practice midwife, you can, which means you just you work for yourself, and you want to deliver in the hospital, you get privileges at the hospital. And to have privileges in the hospital, there are lots of requirements to have privileges, but usually you just have privileges at one institution, because each institution, you have lots of time requirements to be part of the institution, actually. So sometimes people will have more than one institution that they have privileges in, but most will just have privileges in one place. Same with obstetricians. Like if you're going to a private OB, they may practice at one hospital, they might practice at two, but they also have requirements to the institution. We practice home birth, and at this moment we have had a history of having privileges in the hospital, but we currently do not. So we and there's different reasons for that, but largely, like, we take care of people all over the city, and there isn't one place that we can't have privileges in every place. And so so right now we do not have hospital privileges. We only attend people at home. Hi.
So if you don't have privileges, what happens if you have to transfer?
If you if you have to transfer, you transfer to an institution that does obstetrics, and anyone in labor, in the way the law is, anyone in labor has to be taken care of by a hospital when they present. It's considered like an emergency, as opposed to, like, if you're having something going on, with your diabetes, you don't just walk into a hospital and they don't have to take care of you if something emergent isn't going on. But labor is considered essentially an emergent thing. So you go and you can be taken care of in any place that does obstetrics, but we choose where we think people will get the best care. We often will choose to go to where there are midwives. I mean, we try to go to where there are midwives, and midwives we may have relationships with, and stay with people through the process if they ended up needing to be transferred.
So the law, because I know the law used to be that you had to be affiliated with the hospital in order to practice. No, but
No,
then
the
something
law-
changed in the law?
The law used to be that midwives in New York State had to have a written agreement with a provider or an institution to practice midwifery.
And
Yeah.
home birth.
Yeah,
Yeah.
Well, and to practice in the
Private,
hospital, is same thing. So the argument, one of the arguments made to get rid of the law the way that was written is that your regular doctor doesn't have to have a written agreement with a cardiologist if you're having a heart attack and they send you to the ER you don't have to have a written agreement to have somebody take care of you when you risk beyond what your provider and a licensed provider can provide. So we have a scope of practice of taking care of low risk healthy women, and when something goes beyond our scope, we should be able to refer without having this kind of it's a way of it was a way of controlling the profession. So the law changed about 10 years ago. We still have relationships with providers and institutions, but they don't have to be formalized in writing.
What sorts of things would you like if somebody's in home birth and you what sorts of things would be like, oh, this has to go to a hospital now?
What would be high risk or no?
Well, there can be a lot of things.
Repeat the question.
Why would we transfer somebody to the hospital? Why would we transfer care? They would become inappropriate for midwifery care, right? So let's just, if we're going to talk about home birth for a second, whenever you practice any kind of health care, there are guidelines for how to take care of people, right? So home birth, we have a certain set of guidelines. And the first piece why you couldn't take care of somebody for home birth would be, say the couple doesn't agree that you should have a home birth. Or let's say that you don't have a home that's safe for you to deliver in. So even before you go to medicine, we can talk about how midwives, in the best of circumstances, take care and evaluate your psychosocial needs along with your medical needs. So if you had twins, if you became 20 weeks and your cervix was starting to open and they thought you were going to have a preterm birth, if you got ill during the pregnancy, if you delivered blood clots, if you had blood clots, if you were found to have some kind of illness that would affect the pregnancy, then you'd need a higher level of care than a midwife would provide, probably a maternal fetal medicine doctor. Yeah, there's like a whole list of reasons why we would transfer.
So you don't have
You mean during
you don't have a birthing center that has to be someone's personal.
There are midwives who practice in birthing centers.
Right, that's what I'm asking, because you guys work together, but you don't have a place that's.
We
So
don't
we do
have-
home birth, solely home birth
In
at this
people's
point.
homes. Yeah.
Yeah.
Can you explain what that looks like? Because some people just think, oh my goodness, that lady is like sitting on her bed and there's like craziness
I have
happening.
to clean my house for her.
Yeah. Yeah, and we can, so, I mean,
How about if we say,
yeah.
first, why we attend women at home? How's that?
Yes.
Like, why have we chosen that? Because when people ask me, when did I become a midwife? I might have become a midwife when I was born, because my mother worked in a hospital and I toddled around the hospital for the first 4 years of my life. And I'm actually very comfortable in hospitals and I'm very comfortable with doctors. but I choose to deliver women at home now because I think for most normal pregnancies, and if you look at the studies about it, in a well-screened population, it's equally safe to have your baby at home as in the hospital. So when you say, what does birth look like? Well, birth is an important day, but it's like one day of this long period of care that we provide. And so home birth, your birth happens at 9 months, but it starts by meeting us and relationship and being screened. Are you appropriate at 10 weeks, 20 weeks, 30 weeks when you're due for a home birth? And what it looks like, is you call us when you're in labor, and we go to your house with everything that you would have in a freestanding birthing center. Is this helpful? Okay. We bring.
Just imagining like blankets and stuff.
Well, we at 35 weeks you buy a birth kit, and we give you a list of what you need to get: towels, and we teach you how to make your bed. It is not as messy as people think it is. Occasionally it's messy. Yeah. And so we come to your house when you call us. We're with you most of the time when you're labor. We have some of our favorite doula here that might support you if you're a first-time mom and your labor's a little longer. And then we attend you when you give birth and for several hours after. I know there's so much more to it, but the questions really help.
And I would go back and talk and add about like why we attend it. It's real, and it's about philosophy. And I pulled up again. I was like, because Michal said we're talking about. I mean, we can get into the details, and we're happy to answer all your questions about home birth specifically. But midwives, like what is different about us is this, this philosophy of care. So, our philosophy is about, it's about providing individualized care. It's about focusing on you as a whole person, not on just the blood tests or ultrasounds that go along with a pregnancy. So taking care of women and their families, and, it's, like we believe, like our parent organization, the American College of Nurse Midwives in the US, says, we, the midwives of the ACNM, affirm the power and strength of women and the importance of their health in the well-being of families, communities, and nations. We believe in the basic human rights of all persons, recognizing that women often incur an undue burden of risk when these rights are violated. So every person has a right to equitable, ethical, accessible, quality health care that promotes healing and health. And there's more. I don't need to read it all, but it's so about taking care of you in a holistic way. And what we have each felt working in we were good midwives in the hospital, I hope. But I only had 10 or 15 minutes to do a prenatal visit with anyone. And it included a lot of looking at the computer and typing and charting and billing, and in those 10 to 15 minutes. So how much did I get to care for people and get to know people? So being at home, we get to spend time with people. We spend an hour generally for our prenatal visits, and it's very much around getting to know people and provide and see them as individuals. So the philosophy for midwifery is individualized care. But I feel so much better able to practice that when I feel so much better able to provide individualized care when I get to see people in their homes and take the amount of time we get to take with them.
Yeah, and America is a really interesting place right now for maternity care, because it isn't like us against the hospital, but hospitals and people who provide care in the hospitals have a lot of pressure on them in America. You know, we're the only industrialized nation in the world where most people don't deliver with midwives. Yeah. And in fact, in England now, you have a choice with a midwife whether you want to deliver in the hospital or whether you're at home. And for your second baby, they're recommending that you have your baby at home with a midwife. So what you get to see here isn't necessarily like the care in other countries. One of the other things that puts a lot of pressure on the medical system here is liability insurance. When a doctor graduates from, becomes an obstetrician, their medical malpractice is $250,000 a year. And Medicaid typically pays about $1,700 a birth. So when you're in that system, you have to see so many people just to cover your expenses. So again, I keep liking to come back to, it's not us against the hospitals, why I deliver at home. I just, here in America, you can really give quality care because we don't have the pressures of the system to be able to get to know you and and the other women in this room. And there is safety in getting to know people. And so that's one of the reasons why we practice at home and not in the hospital.
So there's so much that happens in the hospital that is about what the institution needs. And there are so many things that we had to do when you work in the hospital, is because these are the protocols and rules of the institution that protects a lot of protecting the institution legally, medical legally, and a lot protecting just time and streamlining things. And there are things that you feel like, well, why did they take my baby to the nursery? Why can't I just have because it's just easier for them to just like boom, 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 get through. If all the babies are in one place and they just go through, it's really not about what's best for you in that moment. That moment is about the necessity of caring for a lot of people and with limited amount of time. And honestly, what we do, the way we get to take care of people doesn't scale. We could not take care of everyone in this room if they were all due in the same, month, but the hospital can take care of you all in that month, but you won't be cared for in a way that's really about what's best for you in a moment. And that's our joy, to take care of people at home and give them what is really what they need in that moment, what that baby needs in that moment, not because we have things that
somebody
have to
needs
get
a lunch break.
Questions like you could ask
Yeah.
later. or
No, please go ahead.
I came late, so I'm not sure. But like, what about, they don't have midwives in hospitals?
Yes, the Borough Park midwives would be, a lot of people in the Park Slope midwife.
You don't work
We
in
only practice in home birth. We have a home birth practice.
But midwives practice in hospital.
Yeah.
Absolutely. Yes, you can get
Saying you
midwifery care.
specifically, you're saying you don't,
We
but-
specifically do home birth, but
Yeah.
midwives, the vast majority of midwives in this country, and certainly in New York City, in New York City, I think there are
There's a lot.
like 1,000 midwives, and there are like 25 who do home births. So we're not, we're like, so we
Thank God,
really.
Thank God I had 5 natural births in the hospital.
Great.
Profession, like no complications, nothing for that. I'm like, I would want a home birth, but I'm thinking like, what's that tiny percent? Like, I need extra help.
So this is a really great question. And
Repeat the question.
Oh,
yeah.
she said, what if she gives birth? What she would like to have a home birth, her 6th baby at home. And you can see every time one of our clients walks in, our faces light up. I have daughters here tonight, She asked, what if a complication arises at home? Should she need something? And that is such a great question. People ask us all the time. They never ask that of their hospital midwife or their obstetrician, ever. If I deliver with you and you have a 40% C-section rate, what's the chances of me having a C-section? So nobody ever asks what the risk is of giving birth in the hospital. What's the risk of giving birth in the Hatzalah ambulance on the way in a snowstorm because my 7th baby is coming very quickly? So there's risk. There's risk the minute you get pregnant, which I had nothing to do with. And so what we do is we try our best, both in our home birth setting and of course in the hospital setting, to make sure that you are low risk for the place that you are delivering. The number one reason that both Kristen and I have delivered from home to hospital is transferred is that nothing's happening. That you have a slow labor, that your water broke, that you're having contractions, you don't dilate or you push, and the baby doesn't come out. It's not.
Why is that a reason?
What's that?
Why is that a reason? I thought that's a reason not to go to hospital.
Well, let's say you've been doing it for 4 days.
Yeah,
there's an end point, right? So, and I've been in the hospital where I've been at the hospital sometimes when they're short-staffed or when people are impatient. I mean, there are things that can happen in the hospital. We really like to be honest. You could be at home and something could happen and you would have wished you were in the hospital. But equally true, and I think more so now than ever, because I've been paying attention to birth for 45 years, there could be something that happens to you in the hospital that you wish that you'd been at home.
So, can you give examples of that?
You could be induced for a non-evidence-based reason. They think your baby's too big. And some of you obviously have heard of that. You are on Pitocin for 2 days. You deliver. And you bleed so much you don't stop. They take you into the OR. You keep bleeding. They pack your uterus. It doesn't stop it. And you end up having a hysterectomy. That never would have happened at home because you would not have been on Pitocin for 2 days.
So, can I ask a question?
Yeah.
Would this happen with midwives in the hospital?
It could. It could.
Because they have to follow a certain.
It depends, right?
It
So
really
it depends.
depends on-
Like if you would it happen in the hospital with midwives? I mean, it's possible. Like that particular, yes. Or you are also making choices. Some, Barry's giving examples of home versus hospital. So those are things that could be the same with OBs and midwives because they may have to follow those same protocols. Like that particular practice wants the midwives to. The midwives also are going to induce for that reason.
Right.
So
if they're in the hospital.
Yeah.
Right.
At home they wouldn't.
Not
Not
necessarily.
necessarily, right?
But you could have a situation, many of the women in your community do not have any sonograms at all. You could have a baby with a heart defect, say, that could come out at home and would not do well. And if you had been in the hospital and had 10 sonograms, you might have known that. So, there's risk in both. There's risk in both places, and that's what I really like to bring home. And it's looking at what you're comfortable with. Less than 1% of women, of the 4 million women that deliver every year in America, deliver at home. Why? It's such a great option. But because basically the risk of hospital doesn't necessarily get talked about. People don't get evaluated for that.
People in your life are going to, if you have your baby at home and something were to happen, everybody, for most people, everyone in their life is going to look at them and say, what were you doing in the hospital? That was a terrible idea.
What were you doing at home?
What were you doing at home? That was a terrible
That's
idea. And you will have blame and, but if you have something happen in the hospital, and this kind of thing happens and somebody loses their uterus, everyone in the life is like telling the story, and it's so upsetting and it's so sad and it's so bad for this person, but nobody's blaming her for choosing to have her baby at the hospital. So I get it. Like, I get that it's really a big deal to step out. Like, our culture, 99% of people have their babies at the hospital. It's a big deal emotionally and culturally to go against that tide and have your baby at home. You know,
Also, I wouldn't want to have in my home. Like, my home is whatever. It's not.
Yeah.
it's not home birth is not for everybody.
Yeah.
Yeah.
If I had a beautiful home, I wouldn't mind. But like, if I have a tiny time home and my kids are all there, I'm not gonna want to have a baby at home.
Yeah.
Yes.
So now we're talking about the even field, so to speak.
Yeah.
What would make someone want to give give birth at home? What would be, what are the, other than the, you spoke about like the long-term care, the fact that you guys have the time to actually get to know that person, but also in that moment, what would be better about, or beneficial for whoever wants to feel more comfortable or whatever at home?
She's asking what would be the benefit of having a home birth.
I think just also for the baby, like not just like she's a mother, but the baby as well.
Absolutely. So so you might want to be at home where you as the mother, your experience, we can take care of you. We can do what you need to do. We can, it's that individualized care. In terms of the baby, there's the difference for the baby. For us, I mean, I've said this now for a while. It's like when I went into home birth and when I went into midwifery, honestly, it was about empowering women and supporting women and then attending home births. It's about women get to choose how, where, what they want, what they need, and that's where I was motivated from. But what I did not even appreciate, even when I started attending home births, was how vastly different the experience for the baby is. So the baby gets to come into it. It's the only place right now that where a baby can have a truly undisturbed birth, a baby, because when the baby emerges, there's no drama going on. There's no, the baby stays with its mother, the baby gets attended to, but there's no drama when it's all well. And even if the baby needs a little something, needs some extra care, needs, to be resuscitated, because you have to help the baby do more than a baby needs when it normally comes out and just cries. Then you have time to you don't cut the cord and take it to a warmer to do that. You're able to do that right with its mother. You can, you attend the baby right there, and the baby's experience is just vastly different.
Yeah.
We
And
hear from the babies. They tell us.
what's that?
The babies tell us.
Yeah.
What you said interesting. My friend just gave birth to her second, and she was like so much trauma. She said that she just like wanted to go in the bathroom by herself, and they're all bothering her. She's like unplugged me from everything. She's just like whatever. And she went to the bathroom, and she said by the time she came out, she's like, okay, like I feel the head. So they all started screaming and making a big fuss, and she's just like,
Put your hands out. The baby's
she's-
coming
and
out.
the
Like,
woman delivering hers like. She wanted to stand up, and she said, I've never done a baby in this position. I don't know what to do. She's like, I can hear you, lady. Like, you're
And it's, I mean, as many things that women are told how it will happen, there are good stories. I don't know how to explain this, but there are good stories like where you have to really work hard in the story. And so giving birth, especially for the first time, can be one of those journeys. And so it's not just that you give birth and it's like, oh, here's the baby and you're all happy. Sometimes it's very disorienting to have another human being come out of your body. And so sometimes our caring for you is not, and the baby is also giving you space after you give birth, giving the baby a moment to take a breath and giving you a moment to take a breath. You know, you get to do things as long as you're safe. You get to do things in the time, in your time. And that means if you want to do things quickly, then you do things quickly. If you want to take your time after the baby's born, we also don't just throw it onto your abdomen. You can take a moment. And so it's so truly undisturbed. And I wish I had it with me right now. I've been working in this community now for 8 years. And the first time I read Toward a Meaningful Life, you need to all read that chapter about birth with the soul coming in.
It's right there.
Very nice.
We have the author here.
It's so absolutely. I looked at that and I went, he's talking about home birth. He's talking about the soul coming in. He's talking about this amazing, mystical, important experience, especially for the baby. And so there are these facts we can tell you about home birth, but you are turning into a mother at that moment. That it is one of the most biggest transitions of your life. And so on the one hand, of course, I'm going to make sure you don't bleed too much. And I can say, oh, I bring this medication, this medication, this medication. I bring IVs and I do this, and this is how I was trained. But the care that we provide, and why I think home birth is really wonderful, is that we also get to care for you. So if you gave birth and I don't know, I hate to make up bad scenarios, but you needed some time after you gave birth, 10 or 15 minutes even, to just get used to the fact that you just gave birth. We can give you that space, and we can give the baby that space to be and to be a family in those really precious moments. And so that's what I really love about home birth. Yep.
And I think one of the first speakers we had, she was talking about how like in the hospital they're on a timer, they want to do things in a certain way, and like, oh, we have to induce you now because it's our timer, or like,
Right.
you know, and or even afterwards we have to give the baby a shot right away.
Right.
It's our timer, like whatever. She didn't say the word timer, but that's what I kept hearing.
Yeah.
So
Yeah, and it's I mean, it's not just that we don't have like that clock going in the same way, but because we get to be with people and because we know you, when this moment happens, like, I mean, it is truly a miracle.
Yeah.
It is a true miracle when a baby is born. And to be able to all be present in whatever way the mom needs to be present, but for us to hold the space for the true miracle that actually happens and not turn it into these things that need to get done is what is, you know, that's what's made this our lives work. It's like, this is so big and so important, and you can't ever you don't get those moments back, and the baby doesn't get those moments back. And so to be truly humble in that moment, and as the family meets each other, and not make it about all these other things, is wonderful. So we also talk about midwifery is the art of doing nothing sometimes. Like, there's all the stuff we do, and that's what Barry's saying. We can talk about all the things we do and the problems, but what about not doing? What about when somebody's, you know, coming out of the bathroom and says, I feel the head, that you not go great, that you go, great. How can I help? It's about to come out. You know, like, what can I not do while supporting somebody? So it's trying to find that balance. And that's a balance we're constantly thinking about, as opposed to, our focus just had to be different when we worked in the hospital. So.
Yeah.
I have a question.
Yeah.
Is home birth covered by medical insurance or no?
So the answer
Repeat
is,
the question.
Is home birth covered by insurance, health insurance? The answer is yes, it is. And none of us are in network, but New York State has a law that says if you're a licensed provider and what you're doing is a legal procedure, then they have to by law cover home birth. Now, they can interpret that any way they want and say, we're going to cover it for $200, or they can say, we're going to cover it for $4,000, or they're going to cover it for $7,000. So different insurances pay different amounts, and Medicaid pays differently than private insurance. And so luckily we have a biller, so we can just sit in the glow of birth, and Haya, our biller, takes care of all our insurance needs.
Hi.
When you're in a hospital, can you like ask them to not induce labor?
When you, the question is, when you're in the hospital, can you can try it. Yes. So people will, it just depends on what the reason is and how strongly people might feel about it, you know. And so there's a lot of bullying that goes on, and in terms of bullying is, I mean, how I would describe it is telling you need to do this. Why wouldn't you do this? Well, this is for your baby. Why wouldn't you do it? There's a lot of and shaming of, you know, if you are making a choice against what somebody wants for you and your baby, and it's very hard to know, do they want this because it's really what is best for me? Do they want this because they want to go home? Do they want this because they're afraid of being sued? And that's what you know, I mean, you could say that, you could have all those questions if I ask you to do something, but you know, but the difference is we have an opportunity to have more of a relationship and have that be a conversation, as opposed to, yeah.
The other thing is that it's a great theoretical question right now, but when you're 9 months pregnant and you're maybe contracting, you're so open and so vulnerable. So to have to fight in that moment is a lot more difficult than talking about it even at an early visit. You know, you say to your provider, well, what if I don't want to be induced? And they can say, oh, it's no problem. And then you think you're okay, but then it becomes much more of a challenge, and it's so much harder to fight at that time, or have your husband fight. And you know, you don't want to be in this place of a miracle and be angry and fighting. That's the tricky part.
And the other thing is can you say no? There are lines actually sometimes you can't. When they decide that if it's something for the baby, there are people who have been arrested. There are many cases around the country. There's an organization that fights for women who have had things done against their will. And if culturally, there's a way in which we actually as a culture often prioritize the baby over the mother. And in some people might say, well, I would prioritize my life over my baby's life, but they can prioritize the baby. And they have gotten court orders and really forced women into C-sections or inductions or things, chased people. People have gone to their home and brought in to be induced and things. They're like, so there are these are extreme, but that's a very real thing. So
yeah, the
it's
doula that came said she had security called on her like more than once.
Yeah.
So. How do you do doulas? Like, does someone also have a doula usually when they have a midwife? Or, I don't know.
So the question is, do people have doulas in addition? Doulas, sometimes, absolutely. Sometimes people do, and sometimes people might choose not to. But yeah, we love working with doulas, but it's all the women's choice.
I'm saying at all my births I had a doula because I felt like what you were saying, that I needed an advocate just in case I make sure they're not taking advantage of me or whatever. Also, thank God my doula has a good relationship with the doctor, so they're like on the same team, which I felt was important.
Great.
You have to bring up studies or like statistics that like address mortality rates between like hospitals and
Sure. Yeah. So there's definitely our studies, and there's an annotated bibliography about all the studies that have been done on home births. I can share it with Nihal. She can share it. But the problem, or not the problem, the issue with studies, there are issues with studies, but even if you just like look at the big studies, I'm very honest in saying, like Barry said, like there's the risk of having a baby die. That's like
Right.
God forbid the
Well,
mother,
that's
but but like the baby dying is about the same at home as in the hospital. But the thing is they're not the same baby.
So
The
we don't
baby
always
that the
right.
baby that died at home, there's a very good argument might not have died in the hospital. But the baby that died that's what you have to address, because that's what you have to live with. This background, first of all, there's background risk when you get pregnant. You can have a stillbirth. That's there. So there's that mortality issue. And that's not going to be about where you choose to give birth. But then there's in the labor, something, bad happening. And it's really honest so if somebody says like, but I'm going to feel better being at the hospital, that's a reason to have your baby be at the hospital. Right. You really have to think about the worst case scenario and how you would be. Whereas somebody else might be like, the worst case scenario for me would be to go to the hospital and have something bad happen that they did to me when I knew I didn't want to do that. And so you have to find that in yourself, I think.
The other thing is with the studies, they had a 4th-year resident at NYU. For her senior project, she dissected the big studies that were kind of negative toward home birth. And she took every neonatal outcome and analyzed what it was. There were 7 neonatal deaths. 3 of them were born at home with unlicensed providers. So you get rid of those 3, right? One of them was the second twin. We don't do twins at home. We're not skilled to do twins at home. And so it's not only just looking at the study, which I was already comfortable with, but taking that and saying, okay, 3 of those things could have happened to me, not 7. And this is a big study, and with little numbers. And then you suddenly, if you honestly look at it, that's how you get the safety. But again, it doesn't matter if it's 1 in 10,000. If it's your baby, it doesn't matter. So each person has to decide for themselves. Even if they told you only 1 in 10,000 babies or moms get harmed, you still have to look at that risk.
Right. So how would you look at it, like in terms of the hospital? Let's say, would it be possible, like a baby that could have potentially, like that loss is like in the hospital, if it was a home birth, can you like play it the other way around?
Absolutely.
You can, both
how
ways,
would that look like? What kind of like situation?
Well, that's what we talked about. We talked about if somebody was induced, let's say. Right. And, the other thing is everybody goes to death. And I get death is very permanent.
No, that's what it comes down to in some, like, at least for me personally. Like, that's
but
what it comes down to. Like,
well, what if you have, so what nobody would ever question you is if you're at the hospital, you get induced, they use forceps, you get a tear, and it's painful to have intercourse for 4 years. That doesn't get recorded as a risk of hospital birth. So there can be a lot of risks of having a baby in the hospital that aren't just about mortality. Right. And it can be even something as simple as, we get a lot of people who've been, what's that?
Getting an episiotomy in the
Getting
hospital.
an episiotomy at the hospital. That's when they cut your perineum in order to, in theory, open up more space. But so you could even be treated poorly in the hospital. We have women who go in having their first baby. They're separated from their husband or their doula. They're in triage. Nobody's talking to them nicely. They're saying, I'm having a lot of pain. Somebody puts their hand in without hardly asking permission, maybe strips their membranes or breaks their water without asking them. She's in a lot of pain. Then the next thing you know, the baby's coming and nobody's listened to her. And then there's a big fuss. And then she gets yelled at. And then you can see I get all anxious and everything talking about this. And then 2 days later, they hand you a baby and say, okay, bye. They've just told you for 9 months and through your whole birth that you don't know what you're doing, that you don't know who you are, that you don't have any instinct. That is not recorded as a problem with the hospital because you and your baby are alive. So when we say risk, we also really think of emotional risk that can damage a woman's self-confidence as she enters into motherhood. Does that make sense?
Right, I just don't like when I try to weigh it, that's what like,
Well,
like
right.
for my comfort or for like not having a traumatic expaudience. Does it outweigh any?
No, she's
I'm saying
saying
I can like in a way take on trauma more than like all death. Like,
Right, but
that's
trauma,
what I like juggle.
but if we did trauma is a lot more common. I mean, when I started, there was a 10% C-section rate in the country. And everybody was like, oh my goodness, it's going to go up to 15%. And now we're at 35%. At Lenox Hill Hospital in Manhattan has a 48% C-section rate. I mean, the damage done to women's bodies. Yes, we don't want you or your baby to die, but there is a deep injury going on the step before death. The other thing is that let's say you were induced, and then let's say you bled a lot, and then let's say you had a heart attack and you died. That death, that would hurt. That maternal death is not recorded as a death in labor.
Really?
So we don't keep statistics on a lot of maternal deaths, and the maternal death rate in America is going up. It's 1 in, what is it, 1 in, your risk is 4 times higher of dying if you have a C-section than if you give birth vaginally. So if you walk into a hospital that has a 48% C-section rate, I mean, that would make me nervous, even if I was not comfortable at home. So I'm just,
so that's
I
it,
don't
you
know
know,
how
we
to make
talk
these
about
decisions.
we take, you know, and because we've gotten so comfortable culturally with C-section, she had a C-section, as if it's abdominal surgery. There are complications from surgeries, including death, and that, but nobody's nervous when anyone's having a C-section. It's like, oh, she had a section. And it's just, but you're nervous that they're having a natural birth at home that's uninduced, and like, it's just, yeah. The fact is, you know, that their death is more, you know, maternal death is going up in this country, and we have one of the worst maternal death rates worldwide, and that is not at home from home birth. So
can I also mention something about how I think you spoke about in the beginning that generally a meeting with a mother is about an hour.
Mm-hmm.
So the amount of time and care you put in that particular person means you get to know her better, and you're able to care for her in a more, coming from more knowledge, from more safety, from more background.
Right.
Does that make sense?
Yes, it does.
well, it makes a lot of sense. Yeah, that there's safety in knowing people, in knowing what's normal for you. I mean, we constantly talk to people, you know, what's the difference when a mom says, you know, I'm nervous about this. This doesn't feel right to me. We try to say, does it not, you know, what's going on for you? Does this not feel right because, you know, because you're actually really worried. You feel in your body something doesn't feel right. This cough is not normal, as opposed to, yeah, you have a cough, you know, we're able to know you and hear you and listen to you in a different way than, you know.
And we can take it either way. I had a client who actually ended up making a short movie about this experience. It was when I was working at the Brooklyn Birthing Center, and there was a big snowstorm. And so it was before I was back doing home birth, but when she went into labor, I went and met her at her house because it was a crazy snowstorm, and they did not plow Brooklyn. How long ago was this? Like 7 or 8 years ago? No, more, 9 years ago. And we ended up getting her to the Brooklyn Birthing Center, and she said, I don't feel right. This is a first baby, and she was a dancer, and she knew her body. She said, I don't feel right. So we transferred to Maimonides, where I had privileges at the time, and I had a great backup doctor who I really liked. And she said to the backup doc, I want a C-section. And he laughed and he teased her and he said, you're a first-time mom, you're just in pain, you need to, I'll just give you some Pitocin and you'll be fine. And she said, no, I want a C-section. And when so he agreed, and we went in, and when he cut her, her uterus was starting to tear, and he gasped. And after the C-section, he cried. Her life and her baby's life was saved because we listened to her. So listening to women isn't just about staying at home and singing Kumbaya. Like this thing that she went on to do a short film about was about listening to her. So I like to say that sometimes women know they need medical care and you listen to them. It's not just about being at home.
I'm happy to share a little bit about my birth story if anybody's interested.
Yeah. I want to say also, I think just to like take away part of the, oh, this is so strange.
Yeah.
I'm pretty sure there's plenty of us that do home birth. If you want to raise your hand, you do home birth. It's true. It's not so, I think some of them left actually. There's more people here, but
yeah.
Shout out to the 2 best midwives.
So I'm playing with Taylor from the Midwives Heights, and Kristen and Barry are by far my favorite midwives. I see some myself also. And at my last birth, your own? My own birth, yes. I've done births with them as a doula as well, but yeah, this is my own birth. My birth, well, first of all, as you know, Kristen Barry is saying, they spend a lot of time and you get to know you. I knew them from working with them, but we still chatted for a good hour for each prenatal appointment. And I think one of my last visits, Kristen asked me, so are there any wishes that you have for this birth? And I actually did. I said, I really want this time to like be more connected to my baby as I'm giving birth to my baby, and like be busy with my hands also, like feel for my baby and feel my body. And, like I remember actually from my a birth for my 10-year-old, Kristen was my midwife. And at the moment when baby came out, Kristen said, take your baby. And I was like so still in my world of pain that I was like, which baby? So I kind of wanted to be a little bit more present for this birth. And so that was really like a goal for me, that I really wanted to, birth my own baby and catch my own baby. This birth ended up being very different than a lot of my other births. And although it was pretty short in time, it was extremely intense. So I had a 10-pound baby who decided to come out completely posterior. And although many people have back labor and posterior babies, this baby, like I just told Kristen and Barry, still stubborn as ever, almost reaching 2 years old, decided that she's going to remain posterior with her full fat, chubby face and come out, looking up at the world. So I had to, work her out, whereas let's say my first baby was born in an hour and 20 minutes of pushing, all my other kids were a couple pushes out. My youngest baby, number 6, took me like an hour to get her, to work her out. While fighting terrible, intense pain, because there was a lot of baby there. But anyways, I had to give a little bit an example of a flip side of midwives who can do nothing and the value of doing nothing. This birth required them to do a lot of things to help me, and they were there to do that. So they can be very active also when you need that. Side note. Anyways, so when she actually came out, and I indeed, was there with my hands, that's something, even though I was in very, intense pain, I did still remember that goal of mine to put my hands down there, feel for the baby. And I remember going like this, and I'm like, what is that? She had a lot of G. They were like, for the first couple months, they were hanging down to her shoulders. What is that? Anyway, so I felt her. And then afterwards, we kind of talked about the birth, and it was actually Shabbos, but Barry did take some pictures and film a little bit, which had been a goal of mine that I didn't really talk about before that. Good thing we didn't, and they didn't ask my permission, because I think Barry felt like because it was kind of intense, it would be good to have some pictures and photos of the moments and to have a timing if things didn't go exactly as smooth as they should have. And so we had a conversation afterward, like, were you worried about shoulder dystocia? Were you worried her shoulders might get stuck and that we would have to deal with, and there are different, methods that midwives know well of how to deal with shoulder dystocia, but the conversation was, is that something you were concerned about? And when we had that conversation, Kristen, here comes your turn. She said, no, because you were so connected to your baby. Like, I saw that you were like one unit, and that there, I guess, and that's something that's not something that you can explain medically. I don't think there's a medical explanation for that. No doctor can tell you because mom was connected to her baby, therefore I had this intuitive feeling that nothing can go wrong. But there is something to say for when there is that connection, and then there's a mood, there's an emotion, and there's a holistic something that's happening there that then can be completed in a wholesome and healthy way because you're connected. So that's, I guess,
Thank you. That's beautiful.
An experience that is the other side. And then I have a client I'm going to go meet. So I have to go. My husband's waiting outside.
Thank you.
Bye.
Thanks
Good
for
to
coming.
The other thing about that story is her tone of voice and how powerful she feels after that. And that can happen at the hospital. When we worked at Bellevue, we had a birth center there, and the hospital before that, it was a very collegial place with midwives and doctors, and it would be, ultimately, I think it would be absolutely wonderful to have a huge center, a huge birth center where you could stay for a couple of days and be deeply cared for and, have families come and go. But that sense when you walk out of this experience feeling empowered is not scientifically quantifiable. A lot of our women feel very whole inside. We get to witness them grow as human beings, but also the dads. I mean, if you've had babies in the hospital and then you have a baby at home, the husbands are so happy that their wives are so happy. And we had a woman who did not ever want to have a baby again. She got pregnant with her 8th. And I just love this. She had her 8th baby with us, and the next morning she told us her 6-year-old walked in, and he came into the room to ask her for something for school, and then he says, "But where'd you get that baby?" And she said, "Well, I had it at home last night." And he said, "Good for you, Mom. I know you don't like that hospital." So the other little piece of home birth, and again, you would not choose home birth for this, is, as some of our women here can attest to, the siblings. Like, there are women in this room, I can tell you about their children. I can tell you which one paints and which one is going to show me the Legos and which one, because the kids get to be involved with their siblings. And that doesn't mean you tell them you're pregnant, or it's in detail. Every woman gets to do what they want to do. But the siblings get ownership of being part. Their sibling is coming, and it's just so wonderful to see the siblings get to greet this new baby and not have mom disappear for 2 days and then come back with another person, but instead be there, and maybe they've gone out for ice cream and they come back and there's another person in the house.
Also about the mind-body connection, like how our bodies react to our environment.
Well, right. So, I mean, that's part of the being, the difference for us in terms of supporting women is supporting people to the more you feel relaxed, the more your hormones are released to letting out a baby is an incredibly vulnerable thing to do. And it's vulnerable consciously and it's vulnerable unconsciously. So the unconscious part is really ruling your hormones and determining your labor. So if you feel incredibly unsafe where you are, we know this, animals, a cat delivers 2 kittens, you come in and turn on the light, oh, it had 2 kittens, and then you're around for a couple of hours, and then you go back to bed, and and then in the morning you find there are 6 kittens. Like, it stopped its labor because it was disturbed, and it was scared, and it was, so your environment has a huge impact. And that can be that home doesn't feel safe, and you are not going to give birth well at home. But many people, the hospital doesn't really feel safe in terms of people, people you don't know, agendas that aren't yours, and a lot of strangers in and out of a room, janitors walk in to change the garbage while you're pushing. I mean, that happens, and you're supposed to be there with your legs up and pushing out a baby, and people are in and out and things. So
what's the difference of I think one of my friends said that she requested a midwife when she was already in the hospital, and then other ones that have their own practice but deliver in a hospital. Is there it seems like there's a difference, right? You guys worked in a hospital,
and we were employed at that time. We were employees of the hospital,
right? So but other people do meet with their midwives ahead of time,
right? And
then the midwife just delivers them in the hospital.
That's right. And so you can definitely, if you're part of a busy practice, they still might not have a lot of time, but there are practices where you still will get some more time with your midwife, hopefully, and you will get more individualized care, but they then work in that system. So, and the comparison I make as the person who's providing care, when I worked in the hospital, even when I took care of people that I knew and I loved them and I cared about what their experience was going to be, when they came in, if things needed to be done for the institution and she didn't want them, and I would have to fight for her to have them, I would say, you can do a certain amount of fighting, but she's going to have a baby and she's going to leave.
You have to work there.
I have to work there. And that nurse needs to not be mad at me tomorrow, because if I really make her mad today, she will make all my future clients really potentially miserable, because she's, punishing me because I made her have a bad day. You have all these relationships to navigate that you're really thinking of outside of the room with that woman. There's all kinds of people who you might be trying to make happy when you're working in the hospital. And what I say is, when I'm working at home, there's no one else I'm trying to make happy other than the person I'm working for that day.
Why you left?
I went into midwifery to do home births. It always was my heart.
You had to.
I did it for experience. I did it for schedule when I had little kids. And so it was a relief, and I knew that home was always how I wanted to practice. But it was for me.
Also, I had to birth the midwife in the hospital, and it wasn't as comfortable as they would never let me push a kneeling position. Never. I told them, I came to you for this. That's why I came to you, not to the doctor. I thought you will let me. And they would say, no, we have protocol. Hospital doesn't let, so we can't do it.
And just the word "let" is really hard for me, because it's people say, what will you let? Not letting you do. I mean, this is a relationship. When you enter into a relationship with, I would hope, midwives in general, but certainly with your home birth midwife, it is a two-way street. I mean, you're hiring somebody to care for you and be aware of things that you might not be aware of, but nobody's letting you do anything. You're being given information, I hope, and being allowed to make decisions for yourself and being supported in the decisions that you think are right for you. But that's not how the system is. It is about let.
I just wanted to say, for everyone who was saying about the risk in home birth and hospital, I'm basically a statistic in the sense that if I didn't have a home birth, my life would have been so fundamentally changed right now, because I had a childbirth-induced autoimmune disease that happened because of childbirth.
What does that mean?
It's called Hashimoto's, and one of the ways that it's triggered is through childbirth, and I had no idea. And I was able to contact them and talk to them. It's not just when you leave the hospital and you go home, you're on your own. After I gave birth to them, they came to my house the next day. They were checking on me. I was able to email them and ask questions, and having that intimate relationship with them. And I could tell them, hey, I'm feeling worse 3.5 months after giving birth than the day after I gave birth. Something is not right. And then to have them be like, let's try to figure out what this is, and then to guide me to the right care, because I needed more care at that point than, that they could offer. But they sent me on that path. And so many women are diagnosed with this disease 10 years after giving birth, 15 years later after giving birth. And by that point, their thyroid is like damaged. There's nodules, there's cysts, thyroid cancer. Their thyroids are taken out. So the fact that I got diagnosed so early on, that's literally because I had 2 home birth midwives. There's no other way. Like if I gave birth at a hospital, they would not be like, oh, it's postpartum, it's your hormones, you're not right. But I was able to have a relationship where I can tell them, listen to me, I'm not okay. And they're like, okay, let's figure this out. And that trust, that's care. That's care right there. So.
Wow. Talking about care, do you provide women's well care if they're not a home birth client of yours?
No. And we hardly provide GYN care. And the reason why I don't provide GYN care anymore is because to be really good at GYN care, you've got to do a volume of GYN care. So for pregnancy, you're mostly well. And if you become ill, I can get you resources. It is called well woman care, but most women go to the gynecologist because something is unwell. And so just trying to really stay up on all the latest things is a little bit tricky. But we have 2 really great midwives that work at Borough Park Midwives. And there's probably a lot of great midwives that take all kinds of insurance and love doing GYN care.
So midwives can care for your GYN care. We choose not to be doing that.
It takes a whole nother setup than we have.
So those midwives in Borough Park, you're saying they're not home birth midwives?
No, they work in the hospital. Borough Park OB/GYN, they have a bunch of midwives who work there, and they're a couple that we really like who do a lot of GYN care.
Yeah.
And I think we're good. Yeah.
Yeah.
Can you give an example of something that you had to do in the hospital that you didn't want to do?
Yes. I can give you so many examples because when I worked at Bellevue, there was can you give an example of something you did in the hospital that you didn't want to do? The biggest example is when I worked at Bellevue, we had a birth center on one side of the 9th floor and a labor and delivery on the other. And when you were on labor and delivery, your baby went to the well baby nursery at 20 minutes postpartum. You were separated from your baby. And so I did everything I possibly could to keep the babies as long as possible. But there was a protocol that they needed the eye medication and vitamin K in under an hour. And everybody on labor and delivery refused to do that. So
they had to go to the nursery.
They had to go to the nursery, and
that's,
that is just horrible, horrible, horrible.
But these days, can babies be with their mothers?
Yeah, babies
I think they're better.
I
think they're better things. Yeah.
Somebody didn't know about this, but she just delivered in Staten Island, and the baby was taken away for 24 hours.
My sister had for 2 days.
Yeah, but there must be a reason, because that's not.
Yeah, no. It was protocol, and she actually got lucky because she got it back in 12 hours.
Well, no, you're right asking that though, because it shouldn't be that way now. I mean, I think places are better. Exactly. Yeah.
So, and I think I have had the benefit of working at 4 really good hospitals in my career. So I don't think I could work at a hospital that, say, had mandatory episiotomies. And there were mandatory episiotomies when I started practicing. That's when you cutting to open up the vagina. Because they believed that opening up artificially opening up the vagina by cutting allowed more room and the baby to come easier. And they also thought that that it's better than tearing. And so they did a big study in LA, probably about 15 years ago, maybe. And they had 1,000 women, and and just to step back, when we were talking about studies, the problem with doing studies in pregnancy is I can't take 2 women who are pregnant and give one treatment and not give another treatment, right? But sometimes you can do a study. So these women in a hospital that was 100% episiotomy rate, half of them were given to a routine episiotomy and half were given to tears because they wanted to show how bad tears are. And they ended up proving that episiotomies are really bad. And so that was the big, huge transition to not routinely cutting episiotomies anymore.
When you show up in labor, you show up like the beginning, like when do you know to cut?
When we're asked to come by the family.
Open my 3 and you'll stay there till the end.
Well, you know, that's funny because that's true. If it's a first-time mom and she's having a contraction once every 20 minutes, it's not a good use of my time for me to be there, right? I mean, so just to be honest, that's the truth. But when we always say the first thing is when you need us, call us. You can also tell and listen on the phone when somebody needs you to come.
I never found that true. Not by my kids.
But if a mom says they need you, then you need to be there. And you know, if she's 3, honestly, we probably don't know that because we don't do routine vaginal exams.
Yeah, we don't.
No.
Can you please talk about that? Please.
So vaginal exams are, so when you're being assessed in labor, one of the concrete ways of assessing a woman in labor is to put your fingers inside and see how many centimeters the cervix is open. Everyone in here probably knows stories of hearing somebody, they were examined and they were told they were 3 centimeters and an hour later they gave birth. So the other way, they were 8 centimeters and they didn't give birth for 8 hours. This is because it's not this linear perfect thing. You're this number of centimeters and we know exactly when a baby's gonna come. So, but it's pretty much our only way of assessing. We assess contractions and we assess dilation. But you know, everything I do, I try to think, why am I doing it? So if there is a reason for me to put my fingers inside of somebody's vagina, I need to have a good reason. So it's and it's not just to say how far are you in labor, because what does it matter? You need support. I'm here to support you, and the baby, you're not pushing yet. There's no baby. So what's the difference if you're 3 or 5 or 7? Like, it doesn't matter. If it's not changing what we're doing, then we're not going to do it.
So
No, that's okay.
So why do they do it? Like,
because it does change what they do. They admit you, they don't admit you, they send you walking. Because they're not just going to sit by your side and wait for the process to happen.
They don't have time.
They don't have time. You know, that's what I mean. I really, like, we're talking about this, but just to say what we do, there aren't enough people to do. If everybody in New York decided they wanted this care, there aren't enough people to provide it.
So then what if 3 people that you're working with are giving birth the same day?
Well, I mean, for us, we don't.
That's a long day. We've had 3 births on one day a couple of times.
So you tell one mother, like, I have to leave and come back.
Did we have a birth just before yours, right? We went from one birth to the next.
I think by my birth, you had like 5 in like 2 days.
Oh yeah, we had birth the same day you delivered.
We got to the 3rd birth. And you must have posted because she said, I saw you just had a birth in Crown Heights.
I think maybe you had a
what does your backup look like?
Well, we're each other's backup.
We come with
one.
Right. So one of us attends a birth with a birth assistant. So there are always two people at your birth. One is a midwife, one is a birth assistant. We love to go to births together, so we have gotten to be at people's births together because one of us will go and one will be the assistant. But if we had two people in labor, we have to split up, you know.
Which one of the women in this room had to suffer with. I had to go sleep while Kristen went to her birth so that I could go deliver the other person later that night. But you know, the other thing is that we always want, we so, as you've seen, each one of you who knows me has walked in the room and my face just lights up, right? And so that is it. But I want you all to know that whoever you deliver with, you're delivering. That's why I hope we get to that point where if you were delivering and I had to send another home birth midwife as a backup because I was at another birth, she has a flat tire, I don't know, you know, I have an appendicitis.
I'm out of town.
She's out of town, you know. That by the time you're giving birth, you know, when I look around this room, there is not one woman in here that I've attended that I'm confident all of you could deliver even if we weren't there. That's the other thing. I want you to get to that point where it's about you and the baby. It's really sad to miss births, but it is, but again, it's not about us. You hire us, you hire us and we are part of your team as opposed to your coming to me in my house, the hospital, in my clinic, in my family. I'm coming to you. So by the time you get to birth, I want you to feel like that you can do it regardless of whether I'm there or not. But I don't like to miss births.
Yes. Somebody who's watching live asked about, where is it? Oh, what do people do about the noise of giving birth at home?
That's a great question.
So the question is, what do people do about the noise?
Especially in Brooklyn when like tiny families and
the noise of giving birth at home, yes.
Well, I generally start by saying that if for most people who are planning a natural birth in the hospital, you are generally advised, you often get a doula, and everyone's planning to stay home as long as possible and go for the actual birth to the hospital. So ideally, you're doing much of your labor at home regardless. So I would say everybody planning a natural birth is probably navigating this, whether you're planning to ultimately deliver at home or not. So, but there's noise. I don't know. and sometimes I also think people think there's way more noise than there is.
Yeah.
So many people say after I was screaming, I'm like, no one was there was no screaming. I think that it's very loud inside your own head. But many times the sounds can be very much like sounds of intimacy anyway. People are navigating that in their lives as well. So I don't know.
You have a bad day with your kids. There's a lot of reasons you have kids. They're running around a lot one day. But honestly, the other side of it is I've only had one person ever come and knock on the door and say, is everything in here okay? That's strange. You'd think that your neighbors would check on you a little more if you were making all these big sounds. But we're New Yorkers, and New Yorkers give each other a lot of sound space.
How do you work your appointments? Like before actual delivery?
What do you mean work them?
Yeah.
People come to you.
Yeah, people come to us for a consult, and then we have a first visit, usually around 12 weeks, that we do together. Then we alternate visits. For many people, we do up until 31 weeks at our office, and for the Crown Heights moms, usually people who are having a first baby come to us a little bit, but we see all of our Crown Heights ladies in their homes for all their visits. I think some women hire us so they don't have to wait 2 hours for a 5-minute visit, and that's it. So
have you ever called you for 30 weeks and been like, now I want to hire you?
yeah, the latest person I've ever taken who lived on Crown Street was 41 weeks and 5 days.
Yeah, but we don't do that
Well, we don't do that anymore.
We've each done that, but
We've
don't.
each done that,
Yeah.
but you know, it's whether we have space, and we hardly ever have space anymore to take people at the last minute. Yeah.
So the
That's the
first
thing.
time I ever gave birth to my baby, I remember she walked in and she said, I want to take away other people's germs, and I want to put myself in your safe space. So can you talk a little bit about that concept, about putting
Well,
coming
there's
to our, like, the women's, the mothers?
well, there's there's a lot of she's asking about germs in your own space versus other spaces, and there's an enormous amount of research at this point. Several years ago I started gathering the articles, and there's no need to gather them anymore. There are articles everywhere about the microbiome, which is the bacteria that live in us that we now know make up 70% of our immune system are the bacteria living in us, largely in our gut. And so the microbiome is like a fingerprint. We all have one. It's unique to us. And your babies, and we're all accustomed to, our microbiome is often determined by our own environment. So you get accustomed to your own germs and bacteria and microbes that you live around. And so babies, when they're born, they need to grow a microbiome, and the seeds of their microbiome are in the mom's vaginal canal. So the first bacteria they're exposed to are in the vagina, and they're meant to be exposed to that, and that is a very good way to set them up for their own immunity, and they have similar immunity to their moms. And also with breastfeeding, nursing, the bacteria we have on our skin. And babies who are able to be born at home, they come into the microbiome of the family, and they're exposed to bacteria that the family already has immunity to and has a good relationship with. And when we're born in a hospital setting, you're exposed to many bacteria that you would never be exposed to at home. So there is a big difference in that. Then there's a bunch of evidence about babies who don't go through the vagina and aren't exposed to that, and that are born by C-section, and the first bacteria they're exposed to has a lot to do with skin, and skin not even from it's from other people. And so their microbiome is very different, and that they've been studies on that, how different the microbiome is, and there's issues around what the implications of that are. But it's very safe in terms of bacteria and stuff, and also beneficial to be born into your own family's microbiome.
What's about the strep B? Like, do you test for that? Or?
We do. So we test for strep B, and we can treat with IV antibiotics like they do at the hospital. We tend to make that much more of an individual. Again, it's not just a protocol. Like if you have strep, you have to have IV antibiotics. We talk about the risks, benefits, the research, how it came about, and the circumstances under which you might choose to have antibiotics versus just automatically be given them. So.
Can you describe like all the items that you bring with you? Like talk about all, like when, okay, the woman's in labor, it's time to go. What do you bring with you? What's in your bag?
So
I was gonna say, can you bring your bag?
right, it's a lot. Well, I mean,
yes,
yeah. What do we bring with us to a birth? So you bought a birth kit, and that has all the gloves and the chucks and the pads and your peri bottle and 4x4s and all those kind of things that you will at one day know exactly what, all the disposable things that, 3cc syringe, what we bring in our bag, I can see the bag in my head. We carry 2 little kits that you can lift out that have everything in case somebody has a hemorrhage. So it's an IV bag, and you open the top and it's got all the catheter and needle and alcohol swab and everything. We have a bag of herbs because we tend to use herbs first when if we think you're bleeding a little bit or we think you're tired. We use them during labor and postpartum. We have everything to suture in case you have a tear. So we have a full kit for the delivery. And then if you have a laceration, we can sew the laceration. So we have that, including lidocaine.
Some
What?
people may not.
Laceration.
And laceration.
It's like a brand
stitches.
Yeah.
When you need a cut and stitches.
There you go.
Thank you. All right. That's so funny. I went to get more complicated. I was like, oh, are you talking about first, second? What else do we have in the kit?
We
have
carry
backup
stuff
supplies.
to resuscitate a baby if the
Right.
baby needs resuscitation. We carry all the medications that you would get in a hospital to stop postpartum hemorrhage.
Yeah.
It's when you bleed too much after the birth. And it's and that's one of the things we also talk about when we have consults with people. It's not just about
everything except for an epidural.
and we
forceps, yeah.
No epidural, no forceps, and no blood transfusion. So and no C-section,
Right,
obviously.
right.
So, but like we love to come to a birth and set our stuff up and rub people's backs and listen to babies and hold space and receive the baby as it comes out and be present for this amazing miracle. But sometimes it's not that easy, and it's not just doing nothing. Sometimes we do have to do stuff, and sometimes things aren't perfect. So that is why we're there. If it were always perfect and easy, you don't need anyone, right? So it's not, we're really there to monitor, make sure things are going well. And if they're not, nudging them back on track to keep things going well. And then when the baby comes out, if it doesn't breathe right away, and statistically 1 out of 10 babies needs some kind of little help to get them started breathing again. And it might just be stimulation, but they might need breaths. We have, that's what we're skilled at doing that. A certain number of people, even though we don't pull on placentas and do things that, make people have postpartum hemorrhages. Postpartum hemorrhages happen under the best of circumstances. So we're carrying those same medications. We're doing the same things.
So hemorrhage is not dangerous at home. You're saying it could be.
It can be managed at home. We can, if you lose. I feel very confident in our skills and being able to stabilize somebody at home. If they needed a blood transfusion, we would need to transfer and, for a blood transfusion. But can we get somebody stable and get them to the hospital? Absolutely. I've never transferred anyone for a blood transfusion, but I know, knock on wood, we don't want that to happen, but we definitely manage postpartum hemorrhage at home because that is going to happen. And, it's like, why should you not have I don't think anyone in this room, there's a free birthing movement around the country. There are people who want nobody to attend their birth. I actually think it's really great to have somebody who can attend your birth and help you with a hemorrhage if you bleed too much. There are a few little things for sure.
And this goes back to your question really well, in that what do we bring? Well, the one thing we really love to say is everybody talks about emergencies, and really there are few emergencies in birth, but there are complications, and we say that's why you hire us in case there's complications. So in our birth kit, what we have is resources and tools for the most common complications, which are a little too much bleeding, encouraging the placenta to come, the baby doesn't breathe, resuscitating the baby, GBS, you need antibiotics, you have the group beta strep. It's a different kind of strep than the strep throat. And so we carry with us anything you would find in a freestanding birth center to help us, help our hands with complications that may arise during the birth and postpartum period.
Because
What about, like, the shots that
emergency,
babies need after?
hold on, let me say one thing.
Yeah.
Emergencies when you are incredibly rare. Neither of us have ever called 911 for a mom during labor. Because also we're not, so many emergencies you hear about in the hospital actually have a lot to do with what's going on at the hospital. 80% of women are on Pitocin who are in the hospital. So I can't say that in those labors that the vast majority don't have emergencies. When you are pushing labor with Pitocin, it's not your body's natural labor. We push it and we monitor, because that now we need to monitor the baby continuously to see how the baby's tolerating it. And then people need an emergency C-section. 80% of people are on Pitocin. I mean, they're being the babies are being pushed and they might not tolerate that kind of labor. So we find that babies really tolerate labors very well when they're just given their moms the natural labor that their moms give them.
4 days, you're saying.
But that's not even about, again, we're not rushing because the baby, it's more like, okay, it's been 4 days. Mom's really tired, and but
You're
we're
saying
not.
technically it's not even dangerous.
We don't wait until it's like in a
Yeah.
situation like that. We're not waiting until it's dangerous.
But at one point it would be, you're saying.
Right, but
I
we
mean,
don't get
yes,
to
I
that
think
point.
that if you look worldwide with no care, yes, that can be a place where moms and babies get too tired or something. And that's where we are happy that Pitocin and an epidural are available and a C-section's available. It's not to say that these things are not sometimes indicated. They absolutely are. And we're grateful that that's available. And we live in a place where that's available.
Have you ever done, or how often have you done emergency transport or transfers?
I think we have like a, I think, you mean,
so we have never transferred, we've each transferred somebody who wasn't a first-time mom once. So if you've had a baby before, your chance of having your baby at home is incredibly high.
Yeah.
First-time moms, I've never emergently transferred a first-time mom. I've never called EMS, but somewhere between around 5 to 7% of first-time moms will need to go to the hospital.
Because they're too nervous.
No, during labor, and then we've had some people who've risked out of it. Yeah.
Wait, why first-time moms more?
Your body hasn't done it. They're the ones who, you might really get to fully dilated and be pushing for several hours, and the baby really isn't fitting out, But if you end up with a C-section we can't promise a home birth. You can plan for a home birth. It doesn't mean you definitely get a home birth, but I do think that if you end up with a C-section and you've been, planning a home birth, you probably really believe you needed it. Like you've been through a lot. You've gotten to the point where you don't feel like it's just about somebody being sick of waiting and that kind of thing.
So you would still recommend for a first-time mom to at least try to do homework?
It depends on who she is.
Yeah, exactly. But we're very happy to attend first time.
And I've been attending births first as an apprentice and then as a student and then as a midwife for 31 years. In that whole time, I've had only 3 true emergency C-sections. And that's when you get the baby out in less than 10 minutes. And those were all at the hospital and they were all for good reason. And so the word emergency really gets used a lot. And if somebody says to you, I had an emergency C-section, say, well, when they told you were going to have a section and when the baby came out, what was the amount of time? And if they say an hour, it's not an emergency C-section. But there's a lot of drama around birth because nobody wants a mom and a baby to get hurt. So, yeah, it's one of those things that
And we know that
Right.
35% of people don't need C-sections.
Right.
We definitely know that is well known. But when you're the one having a C-section, you want to think you needed it.
Yeah.
You want to think you needed it. And so there's going to be a
Right.
lot of support for saying why you needed it. And that's, again, hard to tease out. Like, you know, was I really the one who needed it versus was it because of protocols or, you know, impatience or something?
Would you say that anytime people go in for a planned C-section that there isn't a good reason for it, or?
No, I never say that.
Yeah,
Okay.
never say always or never about anything.
Well, that's a good starting rule.
Yeah.
But like, why would someone go in for?
I mean, in our culture where we are, it is very hard to have a vaginal breech delivery attended by anybody who's skilled and allowed to do it anymore. So they're planned, a baby that's coming, but
first. Yeah.
so those are planned C-sections.
Baby that comes back first.
According to you also.
You guys comfortable?
We
Yeah,
we do not do planned breaches at home. No. So
No, I mean, you would recommend if your client.
I have nowhere else to recommend her to. There was one person attending breaches in New York City in the hospital, and she is no longer practicing. So there's a couple of people, like if they're on, they might do it, but they won't be on call for people. And it's very hard to get a delivery vaginally if you have a breech.
I'm saying I know a few people that plan C-sections in their like second month of pregnancy.
Well, this is such a great question. She's asking about, she knows women who plan elective C-sections in their second months of pregnancy. But I don't know that person. Like, our whole thing is relationship and individual care. So you could have so many different reasons, both physiologically, maybe you have fibroids, and so you're at high risk. Maybe you have a placenta previa. Maybe you have twins, they're both breech. I mean, there could be a lot of reasons why a C-section is necessary, and it's great that we have skilled surgeons in a sterile OR. It's a really great thing. But I'm also not a judge. You could have a woman that has horrible sexual abuse trauma, and she does not want to give birth vaginally, and I'm not going to judge her for that. I just don't think that women should be on a time clock, and 35% of women who do feel bad now about their bodies should be having C-sections. But if you get down to each individual woman, I would question a woman at 2 months who wants an elective C-section. I would wonder why.
That's why I'm curious.
Yeah, but I'm not also judging why somebody would want it, because there could be some good reasons. The World Health Organization believes that 12% C-section rate is appropriate for safe and healthy maternity care. So 12 out of every 100 women, there is a good reason why she should give birth via cesarean.
Wow.
You guys
No,
just
hold on. Yeah.
Do you ever come to a birth and you're like, oh, there's nothing happening, I'm gonna go home, call me back in 3 hours? I'm saying where they send people home, like, look, there's nothing going on, go home, walk around, do whatever.
It could happen. I haven't left a birth in a really long time.
It rarely happens.
It's pretty rare. I mean, they might not. I mean, again, we've built a relationship, and they might not ask me to come the first when it's too early, because we've done a lot of talking about what labor is going to look like and how it's going to, how that might unfold, but if somebody needs you there,
we had somebody that we went to see her, and she wanted us, and then when we got there, she'd had 2 babies with Kristen, and now she was with our practice, and her babies come quickly, and she called us out, and then it slowed down. So we went out and got lunch, didn't stare at her. She called us when they were picking up again, and we went back. That
Yeah,
was
and I
when we
had
were on
and I had
island.
a birth 6
Yeah.
weeks ago, and
Oh,
I was there a couple of times because she'd had babies quick.
very quickly
and-
once it kicked in.
And hung out for a few hours both times and went home because no, it really wasn't. She's like, okay, I guess it's really not happening. And it was a few, I don't know, it was maybe a week between the first time I went over and when she delivered, but yeah.
So
No,
you didn't
because
stay
it's
there a
like,
week.
yeah, so I went because I listened to her because she thought it was happening, and it wasn't, she really wasn't in labor. Yeah.
I think you mentioned that both giving birth at home and in a hospital has risks. The risks are just different, and then the person has to choose which risks they're willing to live with. Is that what it boils down to?
Yes, and you could say risks and advantages.
Once you give
No,
birth,
the advantages
yeah,
for sure.
and supported.
Yeah.
For every woman, that translates differently.
So that translates differently based on what? Based on her knowledge, based on her or is it misconception of facts that people just don't know? Do you know what I mean? Like,
Oh, I think there's definitely a misconception about what we do, people don't know that we're trained. People don't know what the care looks like. People don't know what we bring, these things. But in this group of people, there's now okay, people have heard these things now. I do not think everyone in here would choose to have their baby at home.
What's that?
A lot of times, if I tell someone that I had a home birth, they're like, "Is somebody there with you?" I'm like, "Hello, I didn't. I wasn't the only one. Yes, I had midwives." It's like a lot of people just don't know.
People don't know, but then there are people who, like Hindi just said, you have to be where you're comfortable, and this is even having the knowledge isn't going to make it comfortable for everyone.
So what do you think? Like, I just can't figure out what makes me more comfortable.
Yeah.
Because it's basically just this constant back and forth. So first I'm like, oh, for sure this and for sure that. So what do you think could help me get to a bottom line?
You have to make the decision.
Yeah, you really do. And we also don't make it in a vacuum. I mean, I think people need support. So if your partner is like, there's no way, I don't think how are you going to feel amazingly confident if your partner is?
So maybe my question is different. What would you say is the biggest risk of doing it at home that I have to come to terms with if I choose that?
I remember, Chris, what you told me.
Great.
Okay.
Great. Speak for me.
Yeah. Midwives, and one after she spoke for 3 minutes, I'm like, you're dismissed. Whatever she has said, just oh, I'm not going to take the oxygen because I haven't used it in 3 years. I'm like, no, you bring it up, but we never should ever use it. Different. Whatever. I had to hear what I had to hear. But I remember Kristen at the end of our meeting said, take the time to decide, and when you decide, call me 2 weeks later. So the decision really sits with you, and it's coming from you, and you're comfortable, it resonated, and all that. I don't know if you remember you said that. You probably don't, but
What would be the highest?
Wise words,
What's that?
What would be the highest risk that I have to come to terms with?
That your baby would die. But you have to come to that. No one's baby should ever die. But that's what you're asking. But you have to think about that happening at the hospital too.
Right. So I'm saying, is there anything that you could say? Yes, we admit that at home this is a risk more than the hospital, or no? Do you get my question?
I get your question, but it's again trying to tease out all the scenarios. So we can talk about the scenario that the baby would die at home if you didn't have immediate care. But then we can talk about a scenario where the baby would die in the hospital because you weren't being cared for and listened to and looked, and you were on Pitocin and you might not have been at home. So you can look at all those stories, but I don't know how the teasing out the stories helps.
Say that last sentence again. You don't know?
I don't know how hearing like I can't go through every possible
Right.
scenario
So what do you
with
think
someone.
is responsible for me to do? Like,
She can answer that. And they do
no.
what they do because they
No.
truly believe
What I'm saying is,
what they
I
do.
don't mean which one, hospital or home. I mean, which process should I take? Should I just read and read and read and read until
I don't
choose
know
one?
what your what speaks to your soul in terms of how you come to
my soul
decisions.
to do it at home because I feel that, but I'm also just scared.
Right. What are you scared of?
Yeah, I would suggest you find. I would suggest you go through all your fears and
I'm not knowledgeable enough to even know what I
And
should be
this is
scared of,
research.
honestly.
This is also, honestly,
That's
this is what we
the
do.
thing. That's why.
Most of the people that we work with and come to us have chosen, by the time they hire us, they've chosen a home birth and they feel pretty comfortable
Right.
with it. And if they have questions, then we sit with them and we literally talk for hours. It's
Right.
not an easy thing. I would think, how do I teach you? How can I hold space for you to listen to your intuition? That's what I think. I don't know how you're going to get to that place. I know that if you learn how to make decisions that resonate with yourself, you will go into motherhood much stronger because you will have an intact sense of self and an intact intuition to know what works for you and what works for your family. How you get there, I'm not sure, because I don't know you yet.
But
And
also,
yeah.
we also always say, like in our consults, we are never here to convince anyone to have a home
Right.
birth. That's actually not our ideal client, somebody like at all. We want people who know that this is what they want, because that we're good at supporting that. I'm not here to convince anyone, especially in this, how can I? 99% of people don't do it this way. I don't need to,
What's the difference between a birthing center? I mean, is there such a thing?
So we do like to say going to a birthing center is very much like going to somebody else's house to have your baby. They don't have anything there that we don't bring to your house. So
A freestanding.
a freestanding birth center, a birth center that's outside of a hospital doesn't have anything there that we won't have when we come for your birth at home. Well, there is no actual birth center in a hospital. What's that?
I don't really know of any birthing centers at all.
There
so
aren't.
it's a nice idea.
There aren't any in the hospital right now in New York City. I mean, they write it on the Methodist, it says Methodist birthing center. There's nothing, I mean, there are birth center, actually there is a definition of what a birth center is and what the protocols at a birth center are, which include going home 4 to 12 hours after, babies never being separated. There are things like that that are real, like birth centers. We don't have any currently in hospitals in New York City. There is a freestanding birth center out in Brooklyn though. And it's a Brooklyn Birthing Center.
How's it different than a hospital? And how's it different than a home?
Well, that's what I'm saying is they don't have anything there that we don't.
So why would someone choose a birthing center over birthing at home? Because
Actually, birthing center is further than the hospital than your house is.
To the hospital, yeah.
And the transfer rate from birthing center is much higher than my house to.
Yes, and I would say why people choose a birth center over home again is it feels like an institution. You feel like you're going somewhere. There's staff. There's like you feel like. But we've both worked at the Brooklyn Birthing Center, and I know that I couldn't do anything for you there that I can't do for you at home. So, and as Barry, when it was working there, she's like, there were multiple midwives, and you didn't get to know people in the same way that we get to know people.
People were more comfortable at home.
Well, I got to feel more comfortable because I've seen you 14 times before you delivered instead of walking in and then you're delivering and I don't know who you are.
Oh, so why can't you do that? Visit the person, but have the birth there?
At the birth center?
Yeah.
Well, you could, but I don't work there.
Yeah.
I like working. I think having a baby and having to travel 4 hours after you deliver is
no,
not great.
That's
Yeah.
the part I don't understand.
Right. Yeah. So
They wouldn't. Hold on. Staten Island told me they're making a birthing center.
that'd be terrific. Nobody likes to go over that bridge. But yeah.
I'm curious. I mean, it sounds like a lot of what you guys support is not just like the physical stuff, but also emotional. So I'm curious a lot about that. Like, first of all, do you is part of what you do like really emotionally support the women, like if they're having anxiety, or like have you ever seen women have panic attacks during delivery, and like how do you handle all that kind of stuff?
Most people don't have a panic attack
No?
during delivery. No.
Like they're not like so nervous or like.
No.
Again, it's about the time we've been able to spend together ahead of time, in terms of, yes, we want to take care of people as a whole person, and largely pregnancy in a normal, somebody healthy and having a normal pregnancy, the pregnancy part doesn't need much care. It's like, you don't have to tell your baby to grow its arm, right? It's kind of all happening on it, like without us thinking about it. So we're there, we check on that. We get the indicators we do have for how things are going and that things are going normally. We're checking on those. Then, and in an obstetrical visit, the average obstetrical visit takes 7 minutes. So that's the medical part.
You visit the women's home?
Yeah. So what are we doing the other 53 minutes? We're really, there's a whole person who is pregnant. There's a whole family who is pregnant and having a baby. So a lot of times we're talking to you, just, we're chatting as, it's like, yeah, but it's not just chatting.
For sure.
It's,
you get to see your doctor 14 times. You got a total of an hour. You saw them 14 times. You got 14 hours.
So we know each other, and
14 hours a day.
Yeah, exactly.
You got to know them well.
Good. Yeah, we know a lot, and we hear about the families.
To your client's home. Wow, so you really get a feel for what their life is like.
Well, that's
it.
the whole thing.
Postpartum depression, they'll pick it up.
Is so cool.
They've seen them.
Marriage, what's going on? What's your family of origin? What are you coming into parenthood with? What are your expectations? What are you struggling with? And we're not, I can't fix it all. I can't, but sometimes just being heard, being seen, being understood that you're going through something, and somebody outside of you really seeing you is a
I'm
lot.
explaining that too, when you're, I don't know where most of you are in your before or just married or first baby, but you meet somebody a couple times, you're married to them, you're pregnant. That's a lot of changes. But I can also sit with your husband and say, you dated one woman, you married another woman, now you have a pregnant wife. Like, I get it. So there's this way that you're really the star all the time and you're the number one, but also really acknowledging his experience, which makes it easier for the both of you. Yeah. And talking about postpartum support, it's a lot to lot to handle, to be young and then married and then pregnant, and you go from falling in love to vomiting in the morning. It's very different. And so that has a psychosocial impact that I think just sometimes acknowledging to either one of you can be so valuable, because he does I said this when we were dating and it was perfect. I said this now and she's crying. And so it is about supporting everything, so you two can get to know each other. So it's like, even that, I know that you might have gotten pregnant on your wedding night. It's like somebody who knows your community, knows who you are. I don't know how to explain it. It doesn't mean that you'll never have a postpartum hemorrhage. It doesn't mean that bad things won't happen, but I think they happen far less. And if something happens, we don't abandon you either. We stay with you through whatever happens for you. So yeah.
After birth, what do you recommend for support to be? Meaning, like, I know in a hospital they offer.
I'm over anything.
Sorry, no, really. There is something to be assuring about that, like 24 hours.
I've done both. I had beautiful natural hospital births, but I was also wearing dropped my glasses, and the nurse wouldn't help me look for it, and I couldn't see. I'm like, really? Because it's my job. I'm like, I can't see. I can't find them. You can tell me about my glasses. Or
It's not my
So in
job.
terms of, especially like in terms of
It's not my
like a
job.
first
Yeah,
time mother.
2 weeks to take a
It's so-
shower. So the other woman who was in the room who had just given birth helped her take
Yeah.
a shower. Like,
Then do you recommend like to hire a nurse if you're a first time mother or having someone there that's
It depends. Again, I
Right.
keep saying this. I joke with some people who interview us and they say, do you think we should hire a doula? And I say, I don't know you well enough yet. And you're starting to get to know us to know what that means. So I don't know who you are. I don't know what your family support is. But every woman needs more postpartum care than they get in America.
Right.
So, getting people set up for meals and support. And, if you get a baby that sleeps 6 hours at a time, you don't have a repair and you had a 7-hour labor, you need a lot of support, but it's pretty probably simple, right? Meals and stuff like that. But, what if you do end up with a C-section? What if your baby cries a lot? So we try to, what if you're having breastfeeding issues? You need to think all those different things. We rally lactation consultants and something called an IBCLC to help you. So in our practice, we send a lactation consultant to your home on the 3rd day.
But I appreciate it. Yeah. Labor and delivery was one thing, but the recovery thing, I had good experience in the hospital. So I realized that I would be missing out on that in the home birth.
Right.
Yep. Some people don't, some people don't want to be at home with their kids all there. And we are talking to people about, if you went to the hospital, you would be away for 2 days. Do not just have your kids all around and be up and doing laundry and stuff the next day. That is not a good idea. I totally agree.
baby at home and still go away for
That's right.
few
And
days
a
when
lot of
women's
people are right. Yeah.
Yeah, that's
Lots of
it's a
people are
different
doing that.
Yeah.
Yes.
Still do that.
I
Yeah.
wouldn't even be up to traveling.
Right. And so it's so great. I mean, people can give birth, some people can go to the hospital and have a wonderful experience. And so that can be a really good option for you. My mother worked at a hospital in the 1950s when she had me, and she had a very straightforward birth. She didn't have all the horrible things, and everybody knew her and loved her. And so you can have a good experience at a birth. We know midwives who work at hospitals, they deliver at hospitals. Why? Everybody loves them and knows them. So if it isn't about home versus hospital, it's where it works best for you.
I mean, I didn't need any intervention in the hospital, but
right.
But it was, let's say I discussed before with I had a female doctor, and basically it's several MD practice.
Yeah.
And so I discussed, could I do different positions for the birth? And each one said yes, but I didn't talk to the one that actually gave birth with me. And so he said no, basically I was right after the shower and it was time, the baby was coming out, and he said no, go to bed, go lay down. I'm I didn't want to lay down, and he said no, you and the doula that I had was a substitute of a substitute. So she said, no, it's not safe. You have to lay down. And the baby was born right after. But at that moment, I felt ignored.
Yeah, right.
And whatever, the baby was healthy. I was healthy. Everything was fine. The baby was born a minute later, our first boy after 4 girls. It's very, very exciting. But I'm trying to think what is the pros and the cons, what's important.
Right, and everybody
to be heard is important to have a safe birth.
Well, we don't think you have to choose between those two things.
No,
but
but the baby was fine. He said what do you?
But that's the thing. What are you up? I don't know how old's your baby.
Oh, he just turned 1.
Okay, so it's been a year, and you're talking about it, and you're in tears. Birth is it's not just something to get through to get to a healthy baby on the other side. That is the top goal. That is
like
that, but that is a low bar, that's all we care about, is that you and your baby are alive at
No
the end
kidding.
of this. That is
Like, that's, you
like,
know.
yes, we think you should be alive,
Right.
but the births are, you know, when people, if you talk to very old people who have dementia, who can't say what they had for breakfast, many can tell you their birth stories. Yes, birth, this is so big in our lives. It's so important. So your safety is the bottom line, but there's so much more, and that impacts us.
The birth before my fourth, I felt like I had a home birth in the hospital, like, because they checked, like, the first time my water broke before the birth, all my babies, the water broke, like, during the birth, when, like, not at home. So they said that I had meconium, so they had to monitor me, I had to be in bed, and they said, oh, there's going to be 2 pediatricians are going to come because it's meconium, so they're going to, like, tell me, prepare me for the birth, tell me what's going to be. At the birth, there was nobody there, just my doula, and I told her, like the baby's coming out. I said, okay, so push. So she said, like, and she went to the door to call the doctor. There's nobody there, and that was like my best birth in the hospital.
But see,
but why did I come to the hospital? I came because, in case, God forbid, I needed someone, but there was nobody there.
Well, we also talk about that. Like, sometimes being in the hospital, you think it's they're all ready and just ready to be attentive to you. People are busy. People are in the ORs. People.
It was my best birth, but it's not.
Right, but your best.
That's not why I came to hospital.
Right.
But that's it. Your best birth was the one where nobody was there to take care of you.
Right.
So, but we can't wish to go to.
The doula was also a registered nurse, so she.
Yeah.
I'm saying she had birth. Like
but yeah, you gave birth.
Thank you.
Yeah. Good night.
Thank you.
Good luck.
One last question.
Yeah.
If you don't guys don't mind.
We're doing
good. So someone asked if having a large baby is a reason for induction, a valid reason for induction.
If having a large baby is a valid reason for induction,
whose house size is large? Baby?
So the wording was, is the
baby
10
days before it told me almost 8 pounds. How big was your baby? 6'12".
But the ACOG, the American College of Obstetricians and Gynecologists, do not recommend induction for a presumed big baby.
Mm-hmm. And then what if it's specifically the head seems to be measuring large?
It's not it is not in theory a reason for induction.
Yeah, so you just think of it this way. That's one of our clients watching us, so I waved to her. Let's step back. Let's say that other than gestational diabetes and some certain circumstances, the woman is 4'10" and her husband is 6'9", right? Like, let's say mostly you're just going to grow a baby that fits in your body and fits through your pelvis, right? Let's just start there, that we have faith that process works. If you have a bigger baby, do you want to slowly navigate in a way that it works for that baby, or do you want to slam it with Pitocin and contractions that are unrelenting and make it wedge into the hole? And then they say, see, your baby got stuck. And that's the crazy talk, and that's the crazy reasoning that happens at the hospital. I mean, I'm not saying that sometimes a baby is too big to be born vaginally, but when you're at home and you're not shoving a baby through, a baby that's too big to fit through the pelvis won't come through the pelvis. But if you shove Pitocin with it, it may come half through, but not all the way through. And that's the dangerous thing. So no, I believe that babies grow to the size, and then when they get too tight, they get uncomfortable and they come out. Most of the time.
Okay.
Yeah.
This was incredible.
A lot about home birth.
Yes. Great. Thank you very much. And if you guys don't mind, take a picture with us.
Sure.
Yay. Okay, so we're gonna maneuver this table out.